we saw this one before as well last semester, and this is a hip test, okay? The thought is, if, however, when I do the Faber, the location of pain is not as much kind of inguinal posterior hip, but it's more kind of over that SI joint, and that is the pain that that patient came in with, the Faber test is another way of eliciting force through the SI joint. So we're also eliciting force through the hip, but we're kind of bypassing the hip and eliciting force that's now engaged in the SI. If the SI is problematic, it may produce some symptoms. So specifically, I'm looking for pain over the SI, and it's the reproduction of their pain. Right? So it's the Faber position. So we have them here, flexed, abducted, externally rotated. I'm going to kind of keep them in that position with the foot resting on the other leg. I hold down this ASIS just to kind of keep that pelvis down. And if this doesn't bother them, then I elicit overpressure. So I'm just pushing that knee down toward the floor, and I'm asking what it feels like. Now invariably, and you'll find this among yourselves, you'll feel adductor muscle pull. That's not a positive test. Everybody's going to feel some degree of that. I'm looking for their pain, preferably in the SI joint, is what I'm looking for. Okay, and again, you can check out the sensitivity and specificity of this test. Okay, so this test is the same exact test we use for the hip. It's the Faber test. We can also use it more specifically for the SI if the pain is over the SI and it's the reproduction of their pain.